Good afternoon, everyone. Thank you so much for joining us for our April collaborative meeting focused on the Center of Workforce Innovation for Healthcare Technology and Administration. This Pathways initiative has been quite a journey. We are just finishing up our year one, as we call it, and we are prepping for year two. We couldn't be more excited about the outcomes thus far. We have over 1,200. I'm Catherine Stargell, Vice President of the New Jersey Council of County Colleges, as well as Executive Director of the New Jersey Community College Consortium for Workforce and Economic Development. I'm now thinking back to the 4 other collaborative meetings. I don't think I introduced myself at any of them. I just assume everyone knows me. I'm so sorry. But this Pathways initiative journey has been quite interesting. We've accumulated over 1,200 industry and education partners amongst our 10 centers of workforce innovation, each one focused on an occupational area within the 4 industry sectors that this initiative is focused. We have 20 high schools, 17 community colleges, 9 four-year colleges and universities, 8 labor unions, and 4 community-based training providers and other education associations, all working together to connect pathways in education and training, credit and non-credit, so that all New Jersey residents can obtain or work to obtain a credential or degree. We believe amongst this initiative partners that any education or training that any New Jersey resident receives, no matter the institution, should in fact receive credentials or credit toward a credential or degree. And I'm happy to report that in year one, we have connected 22 pathways. So we are just very excited for the incredible outcomes of all of the education partners, collaboration, as well as the input and feedback we've received from industry in building and connecting these pathways. The Center of Workforce Innovation for Healthcare Technology and Administration is comprised of 2 community colleges along with their other education partners. And I want to take this time to thank the presidents of those 2 community colleges, since the community colleges are really the lead organizations of these centers of workforce innovation. So I want to thank President David Stout, as well as President Boyachi at Essex County College. I believe President Stout of Brookdale Community College could not be with us because of a late schedule change for him today, but we're happy to have President Boyachi as our president, our community college president on hand today. So thank you. And really, we just want to thank both those presidents for sharing their staff and faculty with this initiative, because we understand that all the collaboration and work that went into connecting these pathways was done in the spare time of the community college staff and faculty. So thank you to both of those presidents. Next slide. Everyone is probably aware by now that our seminal industry partner is the New Jersey Business and Industry Association, as well as Focus NJ, which I'm sure Kyle will describe. But it was very important to us to ensure that the voice of industry was leading this initiative to ensure that anyone receiving education and training in New Jersey actually come out with the skills and competencies that they need to help employers thrive in this economy. And that was or is the focus of NJBIA and Focus NJ. And so, of course, they came to us, we went to them. I don't know if it was the chicken before the egg scenario, but the partnership has made this Pathways initiative that much more successful. So I will turn it off to Kyle Sullender to give some remarks.
Thank you, Catherine, and good afternoon, everyone. It's a pleasure to be here and to speak with you all. Again, my name is Kyle Sullender. I'm the Director of Economic Policy Research for NJBIA. I also have the privilege of serving as the Executive Director of our nonprofit research organization, Focus New Jersey, which has also been involved in this effort. I really just want to take a moment to thank you all again for being here, for your continued participation in the Pathways program, and to reiterate a little bit of what's already been said and what will continue to be said for the next hour or so. It has been so exciting and so encouraging to see the progress that has been made in just the first year of what is really a groundbreaking initiative in the state of New Jersey to advance our workforce development ecosystem and to prepare our workforce for the economy of the future. When I've had the opportunity to speak about this program with other organizations and other leaders at the national level, you heard a moment ago where Catherine listed off these organizations and individuals who have been involved in this effort in just the first year: training providers, colleges, universities, industry members, government organizations across the gamut. When we list those off in front of other groups, mouths drop to the floor. The idea that we've been able to bring all of these disparate entities into the room with a shared purpose really does not have precedent in the workforce development space on a nationwide basis. And I can tell you that nationwide leaders are watching what we are doing in New Jersey so that they can replicate our success in the years to come. If you need me to underscore the importance of this initiative anymore, I read today, I believe we're getting preliminary numbers for tomorrow's unemployment rate announcement from the Bureau of Labor Statistics, the state level unemployment rate announcement. And within those numbers show that the labor force participation rate in New Jersey is actually back above its pre-pandemic level, and maybe even higher than it was going back as far as the early 2010s. Despite that, there are 268,000 open jobs in the state, and employers continue to struggle to find the help and the workers that they need to meet the demand of individuals and consumers in the state. And we know that as demographics continue to shift, as demand changes with the changing economy, we're going to continue to face those hurdles as we move forward. The healthcare industry is already feeling this and will continue to feel it even more acutely. And that underscores why it is so important that we continue to drive workforce development in the state and that we do it with an eye on the future. And lastly, I just want to again thank you all, because when we talk to those nationwide leaders, when their mouths hit the floor because of the individuals who are involved in this effort, it is not because of Catherine and I, it's not because of my colleagues at NJBIA, it's because of all of you who are on this call and who have taken an interest, who have dedicated their time and their effort to making sure that New Jersey does reach those goals. And I want to implore you to continue to be as involved as you can in year 2 and year 3 when we get there. Whether you're an employer partner, whether you're an industry partner, an educator, whether you're from a government organization, you are what is making this Pathways program so successful and what's driving us towards the future. So I want to thank you again for being here, and thank you for your continued participation as we move into year 2. And of course, I thank you on behalf of NJBIA. So Catherine, with that, I will turn it back over to you.
Thank you, Kyle. See, this is why you're our seminal industry partner. Thank you so much. So we are here to hear about all the work that the education partners engaged in for the Center of Workforce Innovation for Healthcare Technology and Administration in year 1. We want to thank our education partners. Again, this initiative being led by Essex County College and Brookdale Community College, along with the professional organization, the Health Information Management Systems Society. And it'll be very exciting to hear from their representative who has worked lockstep with Essex and Brookdale on these pathway connections. Also, our partners included Essex County Schools of Technology and Rutgers University. So we thank those education partners. This slide shows you some of our industry partners, our industry representatives on the industry leadership team for health services, who these companies, their executives help guide the work of the center and this initiative. And we're just so very thankful that they take the time out to inform us of their needs, their trends, and confirm for us that we're on the right track. So thank you to all of our industry partners listed here and others. There are many more. So now I am going to turn this meeting over to the real experts. These three individuals have worked diligently to connect these pathways, create programs, evaluate education and training to ensure that individuals receive credit towards credentials and education. And so I'm going to kick it off, I think, to Elvie first. Elvie.
Hi, good afternoon. Thanks, Catherine. It's good to be here after a lot of work and talking about the work that we've been able to accomplish. So Essex County College has had a very extensive dual enrollment program, and we have partnered with a lot of high schools in our county, but particularly the three vocational schools that are our Essex County Schools of Technology. And we've also spoken to Montclair. Basically, in our dual enrollment, we used to just offer courses, but lately, with going all through the collaboratives, we started to put students on a pathway towards a degree. A lot of them with like liberal arts because it's the general education foundation. But what we're doing now, working with the Essex County Schools of Technology, particularly the Newark Tech High School and Donald Payne High School and the West Caldwell Tech High School, we're asking for them to work with us in aligning curriculum and putting students into a pathway that will lead to a degree, but tied to this particular health information technology. We really had a lot to learn, my staff and I, about this particular industry, because although the college already had an AAS degree in health information technology, it had been a while that it was sort of dormant. And so we started looking at the degree and the courses that were there, but in speaking to our high school and their curriculum and in meeting with our business partners and learning and speaking with Rutgers, we really wanted to bring the connection of all three. And so we started going down the path of looking at the health information technology and how it tied to the industry. And as we learned from working with Dana and HIMSS, is that there were other certifications that could be had by the students that would help them to get in. So we ended up doing a little bit of an alignment. It was a discovery model more than anything else. And we ended up looking at our general science degree, which I think many of the colleges may have already a general science degree. The general science degree is the degree where we capture all the students that are interested in allied health programs, such as nursing, physical therapy, imaging, or anything else with allied health. So basically, that particular degree is very robust. A lot of our students are interested in allied health, but then we know that in a nursing program or a physical therapy program, we may only offer 40 or 50 slots, and not all students will be able to achieve and get into those programs because of the competitiveness. So what we decided by looking at it, speaking with both the faculty, HIMSS, and particularly with Dr. Tila Sharifi from Rutgers University, and reviewing is if we take our general science degree the way that it is now and create a certificate program within it that offers the opportunity for biology, anatomy, physiology 1 and 2, and also math, statistics, probability, which is our math 101, then students would be better positioned to transfer over to Rutgers, and that the alignment would be a lot better than our original AAS. So that was a big decision to make, but we took that on. because we thought that we don't want students to be wasting their time or not feeling that there's a connection. So this seemed to be better. So this in turn meant that we share our curriculum with our high schools, and they in turn start to line up some of the courses that they have, or they choose to then offer our courses with the academic syllabi and everything that we have in place already. We're also aware that the anatomy and physiology courses have some prerequisites that students have to meet. So we have to make sure that we offer them that well ahead of time, and that they build the foundation to it. And then that way we create the pathway. So that's part of it. In working with Health Information Management Systems Society and with Dana, we then got exposed to a lot more members of folks who are part of the association, and the different job titles that they had, the different salary ranges that they have, and the skill set that they needed. So we realized that this kind of degree can fit either in general science, or it could also fit in a data science, or which is from another division, or even management. So it's kind of straddling 3 different divisions within the college. So it's taking a little bit of sort of wrapping our heads around it, and really making more connections between our non-credit side to the 3 chairs of other 3 different divisions. So that's what has also led the college to want to consider offering another degree in data science that may also be positioning our students for much better potential jobs that pay high. So we're very excited about this. Our high school partners are excited about this as well. And even though we started with these particular schools, I'm sure that we can continue to grow the interest within the high schools to want to learn more about this degree and to prepare our students for it. So I know that Susan, good.
Yes, thank you, Elvie. I appreciate that. Hi, everyone. My name is Susan Pagano. For those of you who don't know, I am the Acting Dean of Continuing and Professional Studies here at Brookdale Community College. So I'm going to give an overview of the work that we've done as part of the center. And, you know, Elvie and Essex did a lot of work with the degree programs, but here at Brookdale, we focused mainly on the non-credit side. And I just want to give a shout out. I have Scott Shanes, our program manager for healthcare training, here on the call with us today. So we developed curriculum and content that would be delivered as part of the pathways for the health information and technology program. So the first of that includes medical coding and billing. So our curriculum is based on the AAPC curriculum, which would allow students upon completion of the program to receive an industry recognized credential that would allow them to work in medical coding and billing. Also, as part of this program, there is a medical terminology portion that aligns with the credit course for medical terminology here at Brookdale. So students who successfully complete this program and all the requirements, they would be eligible, in addition to their industry recognized credential, they would also be eligible for 3 college credits in medical terminology that can be applied to a health science degree. The second bullet that you see here is the healthcare office administration. So also as part of this pathway, we were able to develop curriculum that is completely OER. So anybody would be able to access it. There are assessments and quizzes and activities built in that cover different modules, including customer service, resume writing, effective communication, management, team skills, interview prep, and diversity, equity, and inclusion, all skills that are really important for any employee who works in an administrative workplace. So these are skills that can cut across any of the programs that are included in the pathway. And really, we see this content as being something that could be included across disciplines, really. And then the third part of this program here is the health information technology. That's all of our Microsoft Office skills. And that curriculum has been developed and also aligns with a credit-bearing course here at Brookdale. So it covers skills related to Microsoft Office, including Word, Excel, PowerPoint, and students would be eligible for 3 college credits for Comp 129, which is information technology, a general education requirement here at Brookdale. And I skipped over the human resources management course that's also listed in there. So as part of the center, we also developed a human resources certificate, which is a non-credit program that's 45 hours, all instructor-led content that leads to the Associate Professional of Human Resources certification through the Human Resources Certification Institute. That's a mouthful. But HRCI has the entry-level credential that does not require any experience. It's just a knowledge-based exam. So it's really good for students who are entering the field of human resources or health administration technology, but related to, specializing in human resources for the first time, right? Because they don't have to have any experience. So we worked with the non-credit instructor here at Brookdale, as well as a business faculty member here at Brookdale. And they redesigned the curriculum so that it would align with the credit-bearing course for human resource management. So they have built out new assessments, new assignments that students in the non-credit course who would be interested in pursuing the credit option would be able to do so. So that all of that development is done. It is currently with the Business and Social Science Institute Dean and Department Chair here at Brookdale. So I expect that that piece will be all buttoned up very soon. So that's all I had. I think Dana will be presenting next, or is it Elvie?
Still me.
Sorry about that, Elvie. Take it
No
away.
problem. Thank you. So just so I should have mentioned who I was at the beginning, but I'm Elvie Vieira. I'm Dean of Community, Continuing Ed, and Workforce Development, and I work very closely with our academic affairs. So I have to say that we really took a multi kind of a prong with this, in that we also offer the medical coding and billing in our non-credit. And we also have an HR certificate program in our non-credit. And we also offer the Microsoft Office skills. So we do have folks already, students, adult learners who take those courses to get non-credit. And so we're aligning and providing them with additional information so that this is not just for our dual enrollment students, but it's also for adult learners who may want to change their careers. And we just reached out to Rutgers University, and we met this wonderful person, Dr. Tila Sharifi, who has been super helpful in doing the alignment. And she met with our chairs. We have Dr. Kamangi in biology, Dr. Harchek, and our math, engineering, technology, and computer science, as well as Mr. Albuquerque, who's the chairperson for our business division, which has a very strong business division. So the three of them coming to Brookdale when we did our presentation, listening to the employers, getting exposed to the information that was going on in the industry, and then speaking with Rutgers is what really started to align the different courses and to have a better understanding, because this could be an industry that, well, it's growing in leaps and bounds, because patient records and maintaining privacy of all of the patients in all of the hospitals across the entire nation is is a taxing and very important for all of us. And part of the healthcare, some crisis that we went through is capturing all of this information. So students can go in it from different points of view. So if you're an adult learner who's just coming in and want to take some non-credit courses, you can do that. If you're on the credit side and you're in the general science degree and you happen to have the competitiveness of getting into nursing and you quite don't get the GPA to do that, but you need something else, what to do with this general science. If you focus on that end, you can consider doing those courses and then transferring to Rutgers. It's very important that we articulate with Rutgers, because Rutgers is the only show in the whole state. When we started looking at who has a bachelor's degree in health information technology, Rutgers was the only game in town. And so we wanted to make sure that we don't sell our students short if they want to continue to go on for their bachelor's, but working with the Rutgers School of Health Professions and getting that exposure, exposing the chairs to the information. Then it turned into us also having a presentation to students that we had and just creating interest at really putting them in a pathway for this. So we're going through the process of getting a new degree approved for the data science, which would fit neatly for students who want to be in the informatics and programming side of the house. And then if you're general science and would like to get human resources and be in management and work within healthcare, then you can go that pathway. Or, so it's these three pathways that we sort of kind of grappled with. And I really have to thank my staff, Mitra Chowdhury, Catherine Skelly, and Joanna Ramos Ribeiro, as well as the chairs and some of the faculty for really being able to come to the table and just have these conversations and do this discovery and quickly start to pivot and looking and reviewing curriculum and connecting it. And we had a professor emeritus, Don Yee, who's very familiar with governance and state approvals, because whenever you're having a new degree or that you're proposing, then you also need to have those approvals to make sure that the degrees all fit in neatly and are approved by our Department of Education and then become also financial aid eligible. So I think that's important to know. For the younger students at the dual enrollment, it could be a lot easier because putting them on a general science degree can open up a lot of room. And if they're interested in health information and computer science, then we're also able to provide them with those certifications as well. I think on the next slide, I believe. Yeah, thank you. So we are working together with Brookdale to create sort of a one-on-one where we line our curriculum with Brookdale's, and together we could put this in a certified associate health information systems way that leads to Rutgers. But then we were also looking at what ECC is doing to go forward. So it's really what can we do at Essex that helps the other community colleges so that they're positioned to also serve their students in their county. And so working with Susan Pagano and her team really was very easy to map up things and look at non-credit to credit. And that also had us looking at what we offer on non-credit for medical terminology and things like that, whether we could connect with our biology chair, Dr. Kamangi, and also have her review some of the courses that we're doing. And so that if the student chooses to get into credit, they don't have to repeat the courses because they can have those credits awarded through internal processes. So all of that is in play. And then having HIMSS, I know that Dana will be ready to speak next, but having HIMSS and participating in their a conference down in Atlantic City exposes to the employers the needs that they're experiencing, and like everyone else, they're looking for well-trained workforce, and we want to be able to prepare students to be able to do those jobs and to succeed and to just have a higher income for their families. So we're very cognizant of that and working with HIMSS and the certifications that they have. We're now reviewing their courses, and Dana will speak about those courses and some of the things that we're doing, but we're evaluating those courses so that they could fit into our non-credit, and down the road, if they tie to any of the credit, then we will also look at how to do that. So we have still a lot of work, but we're really grateful of having this opportunity to having these funds and creating the space for us to focus on something and having the support to provide, even just having the chairs go to another conference and getting exposed to it. All of these things are really important to expose our faculty and our chairs so that our colleges can be a little bit more nimble and create things that are more forward thinking and can prepare the workforce and the students who come to us and the dreams that they have, and that we help them to succeed. So I think that's all I have to say. I think Dana, you're next.
Fantastic. Thank you, Elvie and Susan. It has just been a tremendous pleasure working with both of your colleges. So I'm Dana Castro. I am the Senior Director of the HIMSS Institute. I'm joined here today with Brian Welsh, who is our board president for the New Jersey HIMSS chapter. Brian and I are joining you from Chicago. While we are both New Jersey residents, we're here at the HIMSS annual conference in Chicago, where we have brought in 35,000 members globally. So the size of a city is here in Chicago working on the future of health information management system society. I do have to tell you from two things that have come out of this conference is the focus of data science and AI. Our opening keynote featured, the challenges and the issues, the ethics around data science and AI, and specifically, one of the call outs was ensuring that there's representation of the future developers of AI to help reduce some of the biases. And with Essex standing up a data science initiative, with Essex being a majority minority college, it is absolutely the right move, Elvie. So I just want to congratulate you because the industry is showing up and saying that that's what they need. In addition, one of the other programs on workforce development that we're working on at HIMSS is with the Health and Human Services Office of National Coordinator, the ONC. They have a consortium of 10 consortiums for public health IT, workforce development. They were here today, this week at conference, and I met with them to see how their program was going. They've invested $80 million nationally to modernize public health IT curriculum and create that connection with the industry, similar to what we're doing here with NJ Pathways, but across the whole college spectrum. They have noticed how difficult it has been within the university systems to modernize curriculum and to size it for what the industry the industry trends are with technology and keeping pace with technology. So what we've been through over the last 3 months and the decisions that were made on curriculum, they are spot on. They are similar to what other universities are doing around the country and trying to maneuver quickly, but at the same time going through the lengthy process of curriculum development. So it's just some validation that we're on the right path with this consortium. A couple things that I want to get into on this slide is experiential learning. So what we're looking to stand up at HIMSS is an apprenticeship program, and we would never have gone down this path if it wasn't for NJ Pathways. So it has just been an incredible experience. Earlier this year in January, we did apply for the PACE grant, and we created a 16-week virtual pre-apprenticeship program that connects a cohort of students with business meetings, courseware, mentorships, industry capstone projects, all that help provide the contextual setting. In addition, students have access to the courseware to help them earn the Certified Associate of Health Information Management Systems industry credential. So as we were moving forward on this grant, it did help us mobilize an industry consortium. So this is going to be a little bit lengthy, but I think it's super important for you guys to know the support that's within the state for health IT. So I'm going to read out the board organizations that are part of the New Jersey chapter that are 100% behind this initiative, as well as other industry partners that have come on board. So Hunterdon Health, which is Brian Welsh, where he works, Andor Health, E4, the New Jersey Innovation Institute, Galaxy E Solutions, which will help with, it's a staffing agency, Cooper University Healthcare, Roundtable Strategic Solutions, Atlantic Health, Princeton Healthcare System, Collective Medical, St. Joseph's Healthcare System, Rutgers, New Jersey Medical School, Virtual Health, Complete Care Management, Riverside Medical Group, RWJ Barnabas Health. And then the two additionals that we pulled in are Dell Computers and ZS, a healthcare consulting firm. So you have a broad amount of industry support behind the pathway, and also who would be active participants in mentoring and helping provide students competency strengthening, as well as that translation of courseware to work real world applications throughout this pre-apprenticeship and apprenticeship programs that we're looking to do. Also informed by the industry is those softer skills. So there was interest on bringing in workplace ethics and DEI training, as well as providing career coaching for the students with the outcome of designing a personalized career path, some social emotional learning counseling. And then one of them, and Elvie mentioned this a bit earlier, in our analysis for the top skills that employees were hiring for entry level roles in health IT, Excel was one of those top skills. So we'll be providing Excel and Math Tutor for skill building. And lastly, I want to talk about these capstone projects that students would be participating in. Again, we've designed 3 industry capstone projects to help students really integrate and get hands-on learning. One is with electronic medical records, working with a startup here in New Jersey called Pocket Patient MD, who offers a very easy, very simple electronic medical records for low and middle income countries. So this is a great platform for students to get their first introduction to an EMR, to enter in a patient record, to look at the user experience of the system, and then to look underneath the hood at the coding and software development. The second industry capstone project is on the hardware technical side, and that is in partnership with MRA International out of Long Branch. They are a computer reseller and service provider. So students will be going over to their offices for 2 days and repairing Google Chromebooks. So they will actually get an understanding of the technical side of a hardware and how to manage service calls. All of the computers that the students repair will be shipped over to Africa, and Pocket Patient MD will virtually host webinars connecting the students with the doctors that are using the computers, and having the students actually train the doctors on orienting them on the computers and the platform. And the last industry capstone project is with social determinants of health. So there's a startup in New Jersey called Athea AI, who has essentially collected 240 data points, publicly available data points on social determinants of health. So each student in this capstone project will receive their zip code level data of these 240 social determinants of health, and we'll be utilizing that to look for insights. So this is part of the data science skill building. And then they will validate those insights as they talk with their communities. So those are some of the examples of how we're looking at our apprenticeship programs here at HIMSS. And while we continue to look for funding to support this, we're going to be meeting with the Department of Labor in DC later in July and August to get support, as well as other funding mechanisms to try to get this off the ground. But in the meantime, we're not going to wait. And we have a great lineup of hackathons that we want to do this fall and in the spring. One is a healthcare data science and AI hackathon. And the other hackathon is possibly for the spring would be healthcare technology and climate. So we're super excited about these events. And if we move to the last slide, one of the areas that we're looking at for professional development and being able to connect students with industry is at HIMSS, we have essentially a social media platform called Accelerate. It's www.youraccelerate.com. You do not need a membership to join. We've created a New Jersey NJ Pathways channel. And so and this is to connect New Jersey industry partners with the students. And so as we have these activities like a hackathon, or we have students earning the CA HIMSS credentials, it gives us a platform for that professional networking, for posting job announcement, posting career resources, posting student success stories to elevate them in front of the employer market. And it can also host different ways to promote the courses that are being available in the college systems and so forth. So we're super excited about having that platform available to help with student success. So our next work that we're going to be doing with the pathway is coming up in June, where there'll be a summer HIMSS conference that Brian's leading out on. And so we're super excited to bring the colleges to the conference, as well as I hope, we can invite some students to join us as well into that. So that is, that's what we've been doing here with HIMSS and the Pathways program.
Thank you, Dana.
Thanks, Dana.
Dana has,
so-
I was just going to say, Dana has been a great partner, giving us a lot of access to so many certifications. We're having several of them going through our curriculum committee now to have roll out and include in our fall brochure. And we're also keeping all of this in mind as we look at proposals, and also kind of having an understanding of what's needed and focusing on what skills we need to give to our students, and really kind of seeing this sort of three-prong, which you can go into managing folks within the health industry that has ethics and a lot of things, or you can go into something that's more technology based, of entering information into systems to maintain patient records, or you could be behind the scenes in an IT department with super cybersecurity and protection of these things. So it's a very broad, and I think it could be helpful even for folks who have been in the healthcare industry and may be getting to a point where physically they may not want to keep up with things like even being in nursing or something. So I think that's what was exciting, is that there's different entryways for dual enrollment students, for current students that we have here now, and also for adult learners, or for folks who are working and looking to transition into that. So I don't know if anyone else from my team would like to add anything, and I just want to thank you all for listening to us.
Thanks, Elvie. And I'll just add this last piece here, that is the upcoming part of our pathway work, is that Brookdale will be offering a pilot program mainly geared toward adult learners that is scheduled to start in the summer of 2023. So this will take all of the development that has been done throughout the pathway and actually implement it. And so we have collectively with the Monmouth County Workforce Development Board, we've had a lot of conversations with them about which of these pathways seem to be the most impactful to meet the needs of our specific county. And so the pilot program will focus on medical coding and billing, and the healthcare office administration. So it'll include the OER resources that have been developed. Students will have the content and will learn medical coding and billing that will lead to certification, and the human resources aspects will be included as well. So that is on the horizon, and that will be set to start over the summer.
Thank you to Elvie, Susan, and Dana, and every education partner that participated to create these connected pathways. The work is very interesting. I remember being briefed in the beginning of year one on the extent of healthcare technology and administration, and why we really needed HIMSS participation. And now I see it. having an organization like HIMSS connected to these two community colleges and the high school and Rutgers participation in the center really rounds out the experience for students and adult learners to understand and be connected to the actual work that they will be engaged in the profession. So I'm just so happy that Essex and Brookdale, HIMSS, as well as the County Schools of Technology in Essex and Rutgers University got together to do this work. So thank you very much. Now is the part of the program where we will take questions, and I don't believe there were any in the chat. I would ask if there are any questions for folk to unmute themselves, because I think you'll have that capability now. Ask your question, and LV, Susan, or Dana, or others in the center will answer them. Could be that you guys are just on information overload. I would understand that for sure. Any questions? Okay, hearing none.
That's it. I don't have a question, but I want to take opportunity on
Oh.
behalf of the New Jersey presidents to thank everyone who has participated in this. When it comes to offering the short programs, sometimes it's easier. When it comes to offering AS degrees or associate degrees in any form, we have a long process to go through. Sometimes it could be like a year, 2, 3 years, and the college cannot even add a single new program. So this path and the energy that a few of you have come together to even take us to this level within 1 year, I want to applaud you, and I want to say that on behalf of the president, we really appreciate your effort. One thing I'll remind you is that anything we do, because the academic side, when it comes to faculty, most of them are very, very rigid, and they really want to make sure that they are heavily involved in anything, so that once you get into the higher level, they may not kind of slow down the process. So I will encourage everybody that whatever we do, we share with the academic side, let them be part of it from the beginning, so that we will get their support throughout the process. I just wanted to offer that. But once again, on behalf of my colleagues who are not here, we really want to thank you all.
Thank you so much. Thank you for representing the president today, this afternoon, for this event. Thank you so much. President Boyachi is one of the nicest presidents, not to disparage any other community college president, but
Thank you.
there was a comment in the chat. Frank Preston was surprised to see programs on billing and coding when it was removed from the Department of Labor on demand list. And certainly the Department of Labor had certain criteria and requirements. However, with our industry engagement, we received a lot of feedback about the importance. Again, that's not to disparage the Department of Labor. It has particular criteria tied to the Bureau of Labor Statistics and USDOL. But from a regional standpoint here in New Jersey, and the industry partners that we are engaged with, which includes several of the major hospital systems or health systems in the state, we've been informed that in fact, these programs are needed for their workforces.
Catherine, thank you for responding to that. We are in agreement that we have 100% employment rate for billing and coding and medical administrative work, and the OL, we were surprised that took it off the in-demand list. So in our region, again, we find it very employable and in demand.
Absolutely. Frank is the president, CEO of a private career school that we were working. We'll have to connect again to really connect his curriculum to credit at our community colleges, because it only makes sense. Again, if our goal is, and it is our goal, to ensure that no matter where a New Jersey resident earns or receives their education and training, they ought to get credit for it that leads to credentials and degrees. And so, Frank, I've not given up on that. You know how it is. There are like 5,000 things on my priority list. And so I appreciate your patience, and we're going to get it done. We are.
Thanks.
Thank you. If there are no other questions, and I've not gotten a text from my team saying, no, one more question. I just want to thank all of you all for attending today to hear about the work of this Center of Workforce Innovation for Healthcare Technology and Administration. We have a QR code here. If you open up your camera, scan it, or hover over it, it will take you to a few questions. We're always interested in your feedback about this event, the initiative in general. We're always looking to connect to more industry and education partners, because 1,200 is not enough in our eyes. Here's another QR code that will take you to the registration for all of our upcoming April collaboratives. We have, I don't know how many we have left, quite honestly. It's all a blur. I think we have 4 more left, maybe 5. But if you scan that QR code, you will get the information to all of them. And lastly, follow us on social media. Here are our handles. By following us, you'll get to see all of the information about all of our activities and events. And we just want you to be a part of this magnificent work. So thank you again to our education partners, our industry partners, and all of you for making this possible. We believe we can change education and training in New Jersey by just connecting it all. And that's our goal, and that's what we're working towards. So thank you all for participating this afternoon.